Just think, sometimes your stomach doesn't feel right. There's a bloated feeling, frequent loose stools, strange itching at night around 1 o'clock a.m. that wakes you up. You try to convince yourself, maybe it was something you ate, maybe it's just a bit of stress. But often, the problem comes from something you can't even see. But they quietly make a home inside your body. Today, we're going to talk about intestinal worms or intestinal parasites. In this video, we'll explain in simple terms the symptoms and causes of intestinal worms, how they are diagnosed and tested, their treatment and management, the outlook and chances of recovery, prevention, and how to live with this problem so that you can understand your own body even better. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, a specialist in medicine, diabetes, and hormones. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, let me remind you not to forget to subscribe to this channel. Here, we share simple, science-based, doctor-reviewed health information that helps you understand your body better every day. Let's get started. Intestinal parasites are organisms that live inside the human gut and feed on the food in your body. They survive by using the host. They do not benefit the body in any way, they only take from it. These parasites can mainly be divided into two groups. One is worm-like parasites, and the other is very small, single-celled organisms that cannot be seen with the naked eye. Once they enter the body, they make the gut their home and gradually start causing problems. Symptoms and causes. For example, if a small child keeps scratching at night while sleeping, cries out of discomfort, feels tired during the day, and can't concentrate, or if an adult frequently has stomach issues, experiences gas and bloating after eating, these are common symptoms of intestinal parasites. One such symptom is loose stools or diarrhea. 2. Stomach pain or cramps. 3. Excessive gas and bloating. 4. Nausea or vomiting. 5. Itching around the anus, especially at night. 6. If present for a long time, weakness and fatigue. These parasites enter the body usually by drinking contaminated water or by eating fruits or vegetables that have not been washed properly. You eat raw or undercooked meat, touch your mouth without washing your hands, or walk barefoot on soil, you might not even realize it, but they can enter your body this way. Testing and diagnosis are necessary. There's nothing to be afraid of. The tests are very simple. Doctors usually do the following. 1. A stool test to check for parasite eggs. 2. A tape test for children, especially if there's itching at night. 3. A blood test to understand internal changes in the body. And 4. In very rare cases, a scan if any complications are suspected. Most of the time, just one test is enough for treatment and management, and that's the most reassuring thing. In most intestinal parasite infections, the right medication leads to a complete cure. The commonly used medicines are 1. Albendazole, 2. Mebendazole, 3. Ivermectin, and 4. Metronidazole. Today, there are also Dicazole nitazoxanide. Which medicine is needed and for how long depends on which parasite infection has occurred. This is a very important point. 1. Take medicine as per a doctor's advice. 2. Do not stop the medication midway. And 3. If necessary, treat other family members as well. Most people start to feel better within a few days. Future outlook and chances of recovery? If treated in time, the prognosis is generally very good. After treatment, 1. The stomach problems resolve, 2. Your strength returns, and 3. Daily life becomes normal again. However, if left untreated, it can lead to anemia, malnutrition, serious stomach issues, and even damage to other organs in the body. So not delaying is the best prevention. The good news is, most of these issues can be prevented. To keep yourself and your family safe, 1. Drink clean and safe water. 2. Wash fruits and vegetables thoroughly before eating. 3. Cook meat completely. And 4. Wash your hands before eating and after using the toilet. 5. Avoid walking barefoot outside. Small habits create big protection in daily life. Living with this issue is possible. If you have ever had intestinal parasites, there is nothing to be ashamed of. It is very common. To stay healthy, 1. Do not ignore stomach problems. 2. Maintain cleanliness every day. 3. Teach children the habit of washing their hands regularly. 4. If symptoms return, consult a doctor promptly. The body naturally wants to heal itself. It just needs the right support. The main point is, intestinal parasites are very common and often silent, but in most cases, they're completely treatable. Listen to your body. Do not ignore the symptoms. And remember, awareness is the first step to good health. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, specialist in medicine, diabetes, and hormones. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. If you found this video helpful, please consider subscribing. Share it, because awareness is the first step to healing.